Hi, I'm Dr. Martin Rutherford, certified functional medicine practitioner and chiropractor.
Dr. Randall Gates, board certified chiropractic neurologist, also a chiropractor.
So today we're going to be talking about diagnosis of concussion and traumatic brain injury with blood testing. And interestingly, as I was just telling Dr. Gates that we write articles for a local health magazine, and that I just got done with an article on it's a two-part article, and the first part is why it's very difficult to get evaluated and diagnosed with a concussion, even with all of the publicity that there is out there. Most people understand the publicity relative to the football players now in the NFL. Unfortunately, those guys got to die, and they have to have their brain sliced open to determine if they died from massive concussions, and so that's not an optimal diagnostic tool for figuring out concussions. A lot of you get symptoms. I've had concussions. A lot of you get, you get a concussion. I mean, I've had concussions where I was like dinged up for a couple of days. I had concussions where I literally almost didn't know who I was for like 6 months, and everything kind of like in between. But then once it goes, it's interesting. You kind of, at least now, most of my concussions were before I was 30, and I'm 65 now. But even back then, it was kind of like, okay, it's gone. It's gone. And then all of the things that have changed, like some of your abilities and your personality changes stuff. At least back then, no one ever thought, hey, you had a pretty significant concussion or something like that. And there was no diagnosis at that point in time, other than they sat you. I was playing soccer, got kicked in the knee. They sat me on the sideline for an hour or two. And the fact that I could still walk back up to the field house meant that I was probably okay. So the diagnosis of concussion still has its limitations. And so Dr. Gates is going to talk today about some of the research that's coming down the line, some of the tests that may be coming down the line, so that people can, if their CAT scans are normal. Now, we didn't talk about if their CAT scans are normal, their MRIs are normal. Is this stuff coming down the line? Is it like to have the potential to diagnose it?
It's more having the potential to say if you need a CT scan or not. That's how the literature is framed right now, but we'll talk about what it potentially could mean.
I'm going to be interested to hear what happens if that's positive and the CAT scan's negative. Right. Which is usually what happens when people come in here. They come in and usually are like, I have all these symptoms, and they started after I smashed my head. But all my CAT scans and my MRIs are normal, so they've told me, it'll go away eventually.
That's the story.
Yeah.
So yeah, we've kind of done this preface in other TBI broadcasts before, where most of you go to the ER, you go see a neurologist if you're still having symptoms after a head injury, and you get a CT scan, you get an MRI scan, and everything is normal. And so they tell you you're good, and you probably just had a concussion. If it lasts longer than 30 days or 90 days, then you have post-concussion syndrome. There's not a lot that we know what to do for it. Rest, blah, blah, blah. That's basically the story that most people get. Now, in regards to imaging, we've talked about that in previous broadcasts. There are new imaging modalities coming out that are showing abnormalities in concussion patients versus non-concussed individuals. That's really, really important. But the problem is that these imaging modalities, these are certain special types of MRI scans, special types of CT scans, but they're not clinically employed throughout the country. So they're not commonly used. So if you have a concussion, you can call an imaging facility and say, I want a diffusion tensor imaging on MRI scan. And most of the times they're going to say, we don't do that. So that's a problem. And the other issue is that you need to understand you're getting a CT scan or an MRI to make sure you don't have a bleed. Generally, that's what they're looking at. They're making sure that you did not have a subarachnoid hemorrhage. But then we cross the barrier into lab testing. So there has been research trying to see if there are byproducts of brain tissue breakdown in your bloodstream or your cerebrospinal fluid. And so some of these proteins are called, one of the main ones that's been researched is S100B. Another one that's been researched is heart fatty acid binding protein. Another one is ubiquitin C-terminal hydroxylase L1. These are the most common ones that are being clinically studied. And S100B seems to have the most data. Now that may all be a lot of information for you as a layperson out there, but just know that these are going to be the new tests you're probably going to hear about in 5 to 10 years, just like you hear about cholesterol for heart disease. So they're looking at these brain byproducts, brain tissue byproducts, to see if they're higher in your bloodstream. What does that actually mean? Does that mean that you had a concussion? Does that mean that you have a subarachnoid hemorrhage? Does that mean that you have a brain tumor? They're trying, they being the researchers, trying to elucidate what a high value actually means for somebody with a concussion. And as I said to Dr. Rutherford before we came on, largely these blood tests are being studied because researchers are trying to figure out a way to reduce costs for health insurance companies so that everybody who slips and falls on the ice doesn't have to get a CT scan. Because if you get a CT scan, you go to the ER, your insurance is probably going to be billed $3,000, and the whole visit's probably going to be upwards of $5,000 to $10,000 for you to be worked up for a concussion. So the idea is if they can do a blood test, then they can say, okay, Johnny needs a CT scan or Johnny doesn't need a CT scan. They're getting closer to that point of being able to say with a fair amount of clinical certainty that you need a CT scan or not. Now, the advantage for the concussion patient, though, is that now we're going to have a biomarker, because we see, and biomarker is just that term out there saying it's a lab test, it's a MRI finding. It's something in black and white saying that you have a problem, because so many of you with concussion know that you get a concussion, your imaging is normal, your neurological tests are normal, and we should explain that too. And so you just go on through your life thinking that, well, everything's normal, but I still have symptoms. I still can't think, I'm still disoriented, I'm still dizzy, I'm still having headaches, I'm still nauseous, on and on and on. But your doctors are saying everything is fine. Also, too, we see a lot of concussion patients, right or wrong, where there's a burden of proof. So somebody gets hit in the head.
Car accidents.
Yeah, car accidents, you get hit in the head. Who knows? You're working with your neighbor and something happens in their yard and all of a sudden your life is forever changed because you got hit in the head by a tree branch or something like that. And you have to document that what happened was actually a brain injury, because a big argument in the literature right now is that those of you with post-concussion syndrome, really you just had a whiplash and you're malingering.
Which, by the way, back in the 80s, the same people said whiplash didn't exist. In the 90s, whiplash didn't exist.
You can verify that, yeah. So now they're saying you had a whiplash, you're just malingering, you should have been better in what, 4 to 6 weeks after your whiplash. And post-concussion syndrome isn't real, because other people who experience trauma in these traumatic events, they have symptoms very similar to you. They have post-traumatic stress disorder. If they're female, maybe they have more depression and anxiety, and they have some cognitive symptoms like brain fog, and they have headaches. So you can see kind of the dichotomy that's going on. So the reason why we wanted to do this broadcast today was because even though the research on these blood tests for concussion are mainly there to screen whether you need a CT scan or not, if they do become commonly employed, which I think they will probably in the next 5 to 10 years, then they can be used to substantiate that you did have a brain injury, which is going to be really, really
And I could
beneficial.
see that becoming the standard, and then them not using CAT scans, and then almost literally demanding that the doctor do a more thorough initial evaluation to determine whether it looks like there could be a subdural hematoma for the CAT scan.
Mm-hmm. I'm with you.
I mean, I could see that, because they're looking for cost effectiveness, and if they start doing that and they start seeing a consistent connection between the two, but because they need to look for the subdural hematoma, but frankly, a lot of these people don't have a sign to even look for it.
True, and that's the hard part, because early on you can have a bleed in your brain and maybe it's not really that severe.
Right.
And then you go home, you go to bed, you sleep all night, and then the bleed becomes more severe and you die.
And this is where they say
every doctor's nightmare.
Yeah, this is where they say go home and wake your,
right, exactly.
Wake your kid up every hour, wake your spouse up every hour to make sure that that's not happening.
Completely. And then we have the flip side of it. So we have all these concussion screening tools. And one of the main problems we have in the concussion world is that there's no agreement on any screening tool. So there's all these different ones, and some of them are really good, like the Balanced Air Scoring System, the King-Devick test. The King-Devick test was started by a neurosurgeon, and basically it involves you having to read different numbers or letters on a page in a certain pattern. It's testing how your eyes move, because after people have head injuries, their frontal lobes lots of times don't work as well, and that's where your eye movements are controlled from. And so there's all these tests, but nobody's using one specific test. And then, as we've talked about in other broadcasts, then you have the psychologists the psychologists do neuropsychological testing, which are these battery of tests to figure out if, you know, you're going to be a, you know, some of these tests are used for, let's say, serial criminals, because they're trying to figure out how their mind works. But also in these tests, they're trying to see how fast your mind thinks. Can you process information? Can you switch your brain to another cognitive set, as it's termed, so you switch your attention? Those tests are commonly employed, but there's no end-all be-all test for diagnosing concussion. Really, the current research and clinical information is saying it has to be a clinical diagnosis. I mean, you have to look at neuropsychological testing, you have to look at imaging, you have to look at the neurological test, you have to look at vestibulo-ocular testing, which is what we do. And there's research on that to put together this picture that somebody has had a concussion, the brain was injured and not functioning right. But just the reality of the situation where our healthcare system is going, our healthcare system is going to cheaper, easier, faster diagnostics.
Which is fine if it works.
Which is fine if it works, and these blood tests are offering that. So that's kind of the skinny on it. Anything else that you want to
Diagnosis of concussion, traumatic brain injury with blood tests. So that somebody reads that, then they might think, okay, you know, I'm going to look at this and they're going to give me a way to find out if I have a concussion. So that isn't exactly what we just presented. It's going to be coming down the line. It sounds very exciting to me, okay, because we deal with a lot of concussions. So that person who may have looked in on that, how do they know? Just briefly, not a whole another hour or 45 minutes or 15 minutes, but how, I know you, I think you knew I had a concussion the first day you evaluated me like years ago, but in briefly, what would you suggest for the person who is looking at this, hoping to get an answer as to like, do I have a concussion or not? Is there anything, or is it
for
still
concussion or post-concussion?
I know what we
syndrome?
do here. Well, probably post-concussion syndrome.
Yeah,
the person who's looking has probably had a concussion for weeks or months or years and is just trying to figure out, how do I like tell my wife this is why I'm like this, or I lost my memory, or I can't do math anymore, or I still have headaches, and it started right after the injury. And is there a way? The answer is no. But I know we do it. I know we do it here. You do on your neurological evaluation. But it's something that's in the literature that's not particularly something, as you just got done saying, used everywhere and on all types of things. Would they look for a functional neurologist, or what? What would they do? It's not a sales pitch. I'm asking. Okay.
Yeah, to answer the question, so there are differing scales, not only objectively to examine someone to say you have a concussion. So you see the guys on the sideline in the NFL, and you see the trainer over there, and they're having them touch their nose and touch a target. They may put their feet together and have them close their eyes. Those are objective tests. They're also subjective tests. So if you're at home and you're not in front of your doctor, and you want to say, do I have a concussion? The problem is that there are these differing scales for saying this is post-concussion syndrome and this is not. And there's a lot of literature why some of these scales are good and some of these scales are bad. For example, there's something called the DSM-4 and the DSM-5. The DSM-4 is used to diagnose psychiatric illness. But diagnosing post-concussion syndrome fell within the DSM-4. Now there's a DSM-5 definition as well on this. It's kind of interesting because it's not in the neurological world. It's more in the DSM-4 and 5. But the DSM-4 criteria for diagnosing post-concussion syndrome is different from the DSM-5 criteria. And a lot of these criteria say you have to be knocked out to have a concussion.
Lost consciousness.
And a lot of people aren't knocked out. And that's all throughout the literature. So and then there's the post-concussion symptom scale, I believe it's called. That's another rating system. And I have other journal articles where they go and they look at every potential symptom that's been documented with post-concussion syndrome patients, and you have to put all that together. So there's no one easy, quick answer, and I'm sorry. That's just
well, and then if that's the answer, then that's the answer. I know when people come in and they have a concussion, and I know usually I do the intakes, and afterwards, I used to do testifying and testimony on some of the things that Dr. Gates talked about. Mild traumatic brain injury. You don't even hit anything. You hit your head and you don't even hit your head, and your brain goes back and forth in the brain, and it hits both sides of your cranium, and the next thing you know, you're dinghy and you're forgetting what you do when you walk in the rooms and stuff like that. That happens a lot in car accidents in which the person doesn't hit the windshield, they don't hit the side window. They haven't broken the headrest, and so you have the insurance company going, well, how could they have all these symptoms? So you had to know what the literature was, and so on and so forth. And that's what Dr. Gates is saying. It's a very nebulous area right now. It's in its infancy of this. Part of it is the car injury world that I started first seeing them investigate, and now it's really ramped up from the NFL. So basically, and the reason I asked that question was because I had that background, because I know how Dr. Gates figures it out. Usually we can tell people, look, you've had a concussion and this is what's causing it. The only reason I asked you to say this is because it just makes them feel a lot better. It makes them feel like, okay, I'm not crazy, and that helps the stress to calm down. But apparently there isn't a great way for you to just access that like online or something, because what you're saying is correct. There is no agreement, but that's why Dr. Gates wanted to do this, because there is potentially a simple test, maybe coming down the line that could really clean this up in a couple of years. It would help. It would help our patients a lot. That's for sure.
It would, and just a little more information on that, because I mentioned the S100B and the ubiquitin C-terminal hydroxylase 1 and the heart fatty acid binding protein, all these different ones. There's glial acid fibrillary binding protein, I think, as well. These are the different markers commonly looked at. And for example, with S100B, S100B is not only in your brain, but they find it in other areas of your body. So if you're in a car accident, for example, if you're in an injury, your S100B levels can go up because of tissue injury out here, not just brain injury. But what they're finding is that usually the tissue injury S100B levels tend to decline after 12 hours. So then they can look at S100Bs after that and kind of chart them and see if they're still going up. And they found that usually they go up at about 27 hours is their peak level, and then they tend to go down from there. But that's important because we may have to use testing like that for head injury going forward. For example, when we check cortisol levels, we check cortisol levels 4 times throughout the day. It's called a diurnal pattern. So what is the timing of your cortisol throughout the day? We're probably going to do that with, the whole clinical community is going to do that with these head injury biomarkers, because there's no one perfect way to check for them, because your body is your body. Some of these proteins are in your legs, some of these proteins are in your brain. So they'll probably have to chart them through time, and that's where it's going.
Yeah, so unfortunately at this point you have to find somebody who you believe understands concussion, knows how to assimilate all of this data and put together a consistently a protocol that's consistent in evaluating concussion, and of course we treat concussion, so we think we have that protocol, and our concussion patients do well pretty consistently, so we think we have that protocol and address. Dr. Gates is a board certified functional neurologist. I repeat that's his world. Okay, so, and I think they cut their teeth on dizziness, vertigo, balance, migraines, and concussion, right?
Concussion's a big one. My mentor just published an article where they took individuals with post-concussion syndrome, and it's been documented now, Journal Neurotrauma, I think this year, where they say if you have post-concussion syndrome longer than 3 years, it's never gone away. That's basically the data. So he took a large group of patients, people who had had post-concussion syndrome for a long time, and put them through similar methods as to what we do, and they had a very positive response to the therapy. And basically the therapy involves, if your brain is not working correctly, why don't you go into that part of the brain and kind of make it stronger again? Think of like if you tear your hamstring, you're just going to leave your leg in a brace the rest of your life, or you're going to get back and start moving and then eventually start exercising the hamstring again. And so through certain eye movements and other therapies, you can actually pinpoint different parts of the brain based on tons of functional MRI literature. And if you can rehab a specific part of the brain, you can get it stronger, make it more functional, and symptoms decrease. Yeah. So that's the idea. And that's called neuroplasticity.
Yeah. And the brain needs proper chemistry. There's a whole science. Yeah, I mean, they need to watch our other video on this, because usually the people who get the symptoms for a long time have already been compromised. Like me, I already had thyroid problems, and I was already stressed, and I had a bad gut. All that screws up the brain chemistry. And so you get the brain chemistry right. Now you do the brain rehab exercises, and I am a different human being than what I was 9 years ago. I can tell you that. So yeah. So anyway, so that's kind of like, I mean, one of the complaints we get, on the few complaints we get, we have like a 97% positive rating on our presentations. I think it was what I saw a couple of weeks ago. Is we don't tell them like they're looking like, well, what do you do? We can't tell you what to do, but we can tell you what we just taught you. So maybe that helps. Okay.
And probably watching all of our anything on concussion, traumatic brain injury, you can Google that on powerhealthtalk.com.
I think that's fair.
If you're a researcher or a doctor watching this out there, you can go to powerhealthtalk.com, watch this broadcast, and then we have all the PubMed articles linked below if you want to look at those. And I think that pretty well summarizes it. So
okay,
thanks for watching.
I have nothing else to say.
We'll see you next week.